President Trump had a press conference about fertility today. This is one of the biggest federal fertility policy shifts that we've seen in years. Most people don't actually understand what this means for them or their coverage. At a recent White House event, new policies were announced that were aimed at lowering fertility treatment costs, expanding access to IVF, and making it easier for employers to offer coverage. As a doctor, let me break this down simply. Number one, fertility coverage just got easier. The biggest change is something called the Limited Accepted Benefit Rule. This allows companies to offer fertility benefits like they do dental or vision. Why this matters? Before this, fertility coverage had to be tied into major medical plans. Now, employers can offer it as a standalone, which means more companies can realistically provide IVF benefits. There's a cap of this, about $120,000 per person, and that's meaningful because that can cover multiple IVF cycles. Number two, fertility drugs may get cheaper. The second major piece of this plan is drug pricing. The administration is applying a most favored nation pricing model, meaning the US won't pay more than other countries for certain fertility medications. They're claiming some IVF drugs could drop by price almost up to 80%. That's huge because meds are one of the biggest out-of-pocket costs. Number three, access expansion. This opens the door for part-time workers, people not enrolled in full health plans, military families through TRICARE. As a doctor, that's a big deal. These are groups that historically have struggled with access. Number four, the bigger shift is fertility is now a national health issue. This wasn't just about coverage. The messaging now is clear. Fertility is now being treated as a public health priority. We're going to be focusing on environmental factors, nutrition, declining fertility rates. That's a major shift in how we think about reproductive health. Now, here's an important caveat. Policy announcements are not the same as full implementation. We still need the details. Who qualifies, how employers adopt this, and how pricing actually changes. But directionally, this move towards making fertility care more accessible and more affordable is important. Fertility is no longer a small issue. It's becoming a national conversation, and that matters for millions of couples.